Welcome to forpay.org. This is Consumers Dr. Vengala. Medicare Advantage. Let's look into it. Let's see what exactly this Medicare Advantage is all about. Because Medicare Advantage basically what Health and Human Services is, because it's too complicated, they're giving away their funds to a third party. Because for Medicare, it's cost saving, folks. That's why they do it. Medicare is a cost savings for them to relieve the burden of paying the bills. That's why they give it to a third party, like all the insurers, medical groups, managed care organizations take those funds from Medicare and they manage those funds for you. Yes. What is it? What is the Medicare Advantage is all about? Is medical groups, managed service organizations. So once they get those funds, every month they receive $1,200 to $1,400, whatever they get, they have to manage. Looking at the medical groups, every town, every county, there are several medical groups. Medical groups are independent. They are owned by the doctors, or medical groups are owned by the hospitals. Look at it. So medical groups owned by doctors, there are two aspects. Some majority of the folks, medical groups, they form a group, but they also have a managed service organizations. They directly contract with Medicare. They get funds from Medicare, and they take the money and they manage your health. So generally, whenever there is a medical group, a managed service organization, 15 to 20% of Medicare dollars goes into the management. I wish the Medicare recipients like you and me get those dollars. I could handle better than these managed service organizations. So medical groups are independent. They don't have any hospital. They have to sign up with a hospital. So what they do is medical groups align with the hospitals and they get buddy and they have contracts. So, okay, if you get this much, we collect. So they do have a contract with medical. Most of the hospitals have their own medical groups. And it's a vertical integration, folks. Vertical integration means hospitals, doctors, labs, radiology services, they're all vertically aligned. They own the facilities and they provide the facilities, so they're vertical. Basically, it's like a Kaiser. Kaiser is a non-profit, but most of the hospitals also are non-profit, but some of them are for-profit. So this is how they provide the service. They take Medicare dollars from Medicare and they want to save. They want to provide the services, all the services, with the budget they have. I know they are constrained because they have to manage it efficiently enough. They can survive. I understand all that. Medical groups have to survive. Hospitals have to survive. Everybody has to make it work. But who is better at taking care of having to get these services? I believe it's you. I believe it's the consumer, the patient, the customer. They know how to handle. Because if I get those funds, I know how to handle. Each family can do a better job at handling the funds. Once you give it to a third party, you lose control, folks. That's what I believe in. I really believe Medicare Advantage is not doing you any favor. Believe me, they're not doing you any favor by providing these services. They're taking your money and they're providing the services Not you want, what they want to give it to you. If you want a surgery, if you want some type of a testing done, you need an authorization, man. You need to get an authorization. Everything need an authorization. That's why the folks in the managed care or so-called medical group, they're all complaining because they don't get what they want. So most of these folks who are signed up with Medicare Advantage, they're not happy. They complain. They complain for everything. If they don't get this, they complain about the doctors, they complain about the hospitals, they complain about the services. Then why bother joining this Medicare Advantage if you can afford it? But anyway, it's your choice, folks. Your choice. You're making your choice basing on your pocket. But I'm telling you, Medicare is the best. If you can keep your Medicare, keep it. But a lot of folks, when they join the Medicare Advantage, they're not happy. They complain about everything. And they're not getting services what they need. And everything needs an authorization. Everything needs, approvals. Again, I don't think it's going to last too long. The Americans are, I know they're right now, it's constrained, but at some point, customers want freedom in healthcare. I really believe in that, folks. And if the hospitals wants to make money off of Medicare Advantage, if the insurers want to make money off of the and the doctors want to make money off of these Medicare Advantage, man, it's a business. Go for it. Go for it. But you as a customer have to make the decision what is good for you. I will go with that. I believe in consumers, folks. Consumers are the best to make choices. If they want to get advantage, they're welcome to join, but you are losing your independence. One thing I want, and don't complain too much, because that's what you asked for. Thank you, guys. Thank you for listening. Hit that like button, subscribe, share, and contribute. I know a lot of you folks don't want to subscribe. But if you want to listen more from me, more from Consumers, Dr. Bengala, go for it, man. Just subscribe and hit the notification button. We'll see you in the next episode. Goodbye. God bless.